So just to orient everybody, we are here talking about the COVID-19 coronavirus crisis for dentists. I'm talking with Kathy O'Loughlin, Executive Director of the ADA. I am Paul, Dr. Nacho Goodman. I do a lot of different things. I'm a 42-year-old dad, dentist, husband. I've classified myself as a medium-age dentist, a MAD. I've been doing this for 17 years. So we want to provide some clarity, some awareness to our concerned and scared dentisting community out there. We have a lot of questions before you got on, Kathy, that we'll go through. We'll make this a fluid type discussion that we can just talk, and we may have updates daily. We can do another one. We're not going to answer every question, in one Zoom seminar. I also was sharing with them before you got on, Kathy, that, I'm not an attorney. I'm a dental practice owner myself. I'm trying to just share some awareness here. So I'll let you start off. If there's anything you'd like to start off by saying, we'll turn the floor over to you.
Sure. Well, before I came to the ADA, I had a practice for over 20 years. So I'm completely in sympathy and in sync with what's going on in the practicing community. This is an unprecedented crisis. We have never seen anything like this before. And going back to the HIV crisis back in the 80s with bloodborne pathogens, fundamentally changing the way people practice dentistry forever. This is that pales in comparison to what's going on now. So what are the big issues? First of all, this country was a little slow to get on the transmission prevention bandwagon. I think we watched China and we watched Europe. We said, oh, that won't happen in the States. Well, it is happening in the States. We're trailing what has happened in Italy by about 2 to 3 weeks in terms of the speed of transmission. We went from under 100 cases to 5,000 in less than 5 days. So if you do the math, we expect to hit 1 million or more affected individuals, and high-risk people include people my age, over 60 with comorbid medical conditions, heart disease, diabetes, cardiac, whatever. And what happened in Italy could happen here. Children from 2 to 20 can be infected and be asymptomatic.
That's important for us to say.
It's very important to hear.
Not every, because we're one of the things, and I want to you give the floor mainly to you. I just want to interject as the representative practice owner in person, and that's where people are saying I'm taking people's temperature and asking if they're sick. But the problem is I just have been getting many anonymous messages, and a dental student is self-quarantining because he was spending time with someone who showed no symptoms at all, but now has the virus. So that's just something that's very scary to me. In that we could be interacting with people and patients who are showing no symptoms. So what you're saying
exactly. And so if you're a pediatric dentist or an orthodontist, assuming your kid population has no symptoms is not going to keep you and your staff safe, because the mode of transmission is not bloodborne, it's through aerosol. And I have really not been able to come up with a dental procedure that doesn't create some type of aerosol. As much as we use rubber dams and high-speed suction, it's flying around. And if you're in close proximity to that, which is, unless you have 15-foot arms and a magnifying glass that goes 15 feet, you're going to be on top of that patient. So
and I want to pause for a second and just share with our community, because I did a podcast yesterday with my good dental friend, dental focus attorney Rob Montgomery, and Linda Harvey, an OSHA expert. And back in the early 2000s, I was a restaurant server, and it was very normal for people to smoke in bars. And you would walk in and there'd be a clouds of smoke, right? And that was totally normal for you young people. That was normal. And they said all of these people there working are getting secondhand smoke. And I just want people to take that visual and think, when you do a prophy, when you draw on a tooth, you're making these aerosols, and that's what your dental operatory is like. And if saliva is red is one of our classic OSHA videos, and I think we'll need to make something for this, because what does this virus look like? It's invisible, but it's all around you, and that's why we need to talk about the PPE and things like that. And I also want to share, Kathy, because both of us are people. Even though we work in the dental community, we still count as people, kind of. And, I'm here in Center City, Philadelphia, and I'm just sharing what I'm doing as a person, as a dad, as a husband. And I love eating nachos, 2 or 3 blocks away, but that restaurant is closed down right now. Lucky, I always have backup nachos. I carry them all the time. I got big bags. I got small bags. It's my emergency fund. But what I want to share is, as a person, unrelated to dentistry, I'm staying home with Mrs. Nacho and the moderators, going out as little as humanly possible, because I want to do my part to stop the spread. And I also want to do my part to protect myself. So just as a person here in
Right.
Philadelphia, United States, we're not supposed to be out of our homes unless it's necessary. And I know we're going to talk about this, and people have asked, what's the difference between recommendations and a mandate? What's going on
Sure.
in San Francisco? But I'll turn that back over to you. But I just wanted to highlight, if we're taking some take-home points, that people can be carrying this with no symptoms at all.
Yes, I mean, and the ADA building is next to Lurie's Children's Hospital, and we've been in contact with them. What are they seeing clinically? They are seeing their first COVID cases where the kids are symptomatic and extremely ill. So some kids can be carriers with no symptoms, and some kids will get the illness severely, just like any high risk group. I think goal number one is to reduce the transmission rate and be a good citizen. It's painful to have your kids home from school. It is painful for dental schools to close their clinics. It's painful for dental practices to wind down and to see only emergency patients. That is our recommendation. Dentists are well-educated, highly trained healthcare individuals. They need to make their own best decision based on the evidence, their clinical experience, and their level of confidence that they can keep their staff and their patients and themselves safe. And I think the big message is here, you cannot assume that asymptomatic patients are COVID-free.
Yeah.
So unless you're testing people, your staff and your patient base in advance and getting that confirmed negative, you can't be 100% sure that that patient is COVID-free.
So the themes of this discussion, I've been talking about this, are the S's: safety, sanity, and stress. And I still want to stick with safety here. And I
Right.
want to, sometimes when people say there's a recommendation, there's not a mandate. Well, we are getting mandates from certain states and certain health departments. One of my favorite plays is Hamilton. And I feel like we are back in the days of these, states versus the government type of decisions. But what I'm sharing with, and what I've really just honed in on with Linda Harvey, is if you make a decision to be in your office, and you're the employer, right? OSHA doesn't apply to you as the employer, but you're required to provide your team and your employees with proper PPE. And can people answer that we're doing that now? The N95 mask was not designed to do dentistry in. I was a hospital resident. I've been fitted for those. I've been fitted for those masks. They're not designed for 8 hours of use. And the second you take that mask off anyway, we still have that aerosol smoke issue going on all around us. So just share with me from your angle, the ADA's angle, or where we are with saying to dentists who say, I want to do the right thing for my team, can we protect them with the PPE that we have?
CDC is still recommending surgical grade masks that have been approved by the Food and Drug Administration. So the current PPE is the current CDC recommendation for treating what you consider a low risk patient or an urgent care patient. So you're safe with a face shield, with a surgical grade mask. We are suggesting, because of how long the virus lives on surfaces, all surfaces, that you use disposable paper gowns. And not have people, wear cloth clothing, but in between patients, you're changing those gowns. N55 masks were designed for construction workers to keep them from inhaling, particles like asbestos during construction. If you can get those masks, they are what the hospitals are moving toward using as part of their protocol for treating symptomatic COVID patients, in addition to everything else.
I appreciate you sharing that. One of the challenges here in this thing has just become so exceedingly complex to make decisions. Is there was just postings on Facebook groups in here in Philadelphia from physicians saying, does anyone have any extra N95 masks? We're running out. I got to come home to my house. I have to do this. We have physicians quarantining themselves in their garage apartments so that they go treat these patients. So we have this issue, this moral and ethical issue of should we be using these masks that we need to have on the front line anyway?
Yeah, so we're seeing a lot of dentists are calling me and emailing me saying, my local primary care doctor just asked me if I have any PPE I can lend them, because they're running out. So you have to use your best community sense and say, where are the priorities right now for this community? Philadelphia has been hit hard. Transmission rates there are skyrocketing. Chicago has seen the same thing. Everything in Chicago is shut down. Can you imagine Chicago on St. Patrick's Day with
Yeah.
no restaurants and no bars open?
And we'll talk
That's
about the economic
serious.
impact. And then running the Dental Nachos Facebook group, which I love doing and is growing, I get messages and saying it's not in my state. And first of all, they confirmed it's in all 50 states anyway. But
It is today in all
yeah,
50 states.
but the way to keep it out of your area is to do these preventive measures. And, a few weeks of production is not worth the long-term pain. And I'm just sharing it with my people and be like, I know this is going to totally suck. Just trying to think of ways that we can all make it suck a little less, because for us to get back to our dentistry world and being annoyed by those crown preps and class twos again, we may need to bond together to do. So from a safety issue, we've reviewed the human being guidelines of stay home, stay safe, stop the spread. We've talked about the dental guidelines of right now we have recommendations. What does it take for a recommendation to become a mandate? I'm assuming the ADA can't make a mandate, but who does?
The ADA cannot force dentists to do anything. The mandates will come from the government. And to me, that is not a preferred outcome. I think that would put tremendous constraints on all of us. And I mentioned this to another call this morning. If citizens continue to disobey the community-based recommendations, right? Stay out of restaurants, stay home if you're sick, work from home. ADA is complying with every mandate in Chicago and Illinois right now. And it is not easy. Trust me.
I think what's important is, I am here, you want it. Everybody wants more time with their family. Well, I got it, Kathy. I'm with my 5 and 2-year-old and wife. We're awesome, but we're together a lot right now, and we're only 3 days in. But I feel the recommendations are like when I say to my daughter, can you turn down Bubble Guppies and Paw Patrol? It really is important you turn it down. And then going over and taking the remote away is that mandate. And I just think if we could just turn the volume down and just act like a team out there. And for dentists to say, I got to wait for a mandate to do anything, that, while we stay on this safety thing and move towards staff.
Right. We would hate a dental office to be identified as a source of COVID.
Right. And that's what I want to say. Whether I'm closing my dental offices for safety. I don't know. I don't want to put my patients, my team, myself in this situation. If I don't know if it's safe, I'm closing, and we'll find out more later each day. But for the dental offices that are saying, I want to maintain my production, I say it's equally important to close, because if you are identified as a source office for the coronavirus, if your team member gets the coronavirus from you being open against recommendations, I believe, and I know we have to ask attorneys, this opens you up to all kinds of liability and even just personal stress. I mean, one of the questions that's being asked is our malpractice insurance going to be covering us if we're working against recommendations? And do we even want to find that out?
I would suggest people accept the recommendations as good, solid, evidence-based advice.
Yeah.
I do want to get to the issue around, so what do we do for dentists? Because dentists are unique small businesses. I would say most dental practices have business continuity insurance that does not include influenza and virus and pandemics. I suggest everybody dust off their policy and take a good hard look at it. And what kind of relief does the ADA have to start putting together and package to deal with things like, should I lay off all my staff? How do I retain them and keep them for the long haul? We know this bill, it's HR 6201, which has not passed yet. It's still being played around with in DC, has extended unemployment insurance for 24 weeks for every state. That'll be a federal mandate.
And I love this, Kathy. We're just segmenting this from safety, and now we're moving towards staff, because the overwhelming questions before you jumped on games, what do I do with my staff? I'm a dental practice owner. I have 20 plus team members. I talked with Rob and Anna Hess-Lindsay from Your Dental Lawyer podcast yesterday. I'll share some of that. And what I also want to share is right now, all these are stories. Dentists are always looking for studies. We're inside the movie. It's happening now. We're living it. We don't know how it's going to end. So if someone says I need a study, we're in this game. I was played sports. So let's just say we're going to talk about team and staff. So you're a dental practice owner and you have to decide, my office is closed. What do I do with my team in paying them? Can I pay them unemployment? Now I'll let you kind of
all right. So this federal bill 6201 is going to make it mandatory for employers to pay extended FML, family medical leave, and unemployment coverage. So if you're, for example, the ADA is subject to that. I will continue to pay my employees as they work remotely for the next whatever number of weeks, right? You cannot cut them off. We're trying to get dentists exempt from that. So that will allow the dentist to make an individual decision about what is the best way to handle his situation or her situation. We have seen practices continue to pay their staff, and they're doing non-clinical work in the office. Everybody loves clean the office day, right? Well, now you may have 2 weeks of clean the
The
office.
challenging part, and I want to just pause and jump in as a business owner. So I'm very sensitive to this challenge for everyone. But I was talking with my team last night, and I think when people are talking with their team, I'm a big word person, they should use the word dental practice, because, it's Paul and Jeff Goodman as the owners, but we can't say Paul and Jeff can't pay you. We have a dental practice and we have team members. So we have team members, we'll call them Jill. Jill's the team member. Jill says, how am I going to pay my rent, my food, my bills? Because the dental practice pays me. But then if the dental practice is shut down, who pays the dental practice? So at a certain point, it seems like there's a divide where you can have your team right now apply for unemployment as soon as possible. Anna and Rob yesterday told me this is not related to COVID. This is their recommendation from our podcast. I'm not giving legal advice. If the dental office is closed through no fault of the employee, a vacation to France, a remodel, or the COVID-19 crisis, if it is closed and the employee cannot control that, they can apply for unemployment. Apply for unemployment. So this fits here. So one of the things that I've seen on some of the groups is, do we want our team members applying for unemployment as soon as possible? Because they're trying to get online for this unemployment. If we try to say, hey, this dental practice we can pay the team for 2 weeks. We can exhaust the bank account. We can do this. But what happens in that third week, possibly that fourth week?
That's right.
And that's why you're trying, because what money does the dental practice, not the dentist, if there's no dental work being done and the government says you have to pay your team members, the dentists are going to say, okay, with what money?
That's right. That's why we're trying to get dentists exempt from this bill. Now, remember, this bill is changing hourly. And as soon as we know what it says, we'll do a mass communication out with some advice. But for now, I think dental practices who feel the most economic strain can lay off their teams with a clear understanding with their teams. You will be back as soon as we are back open.
And that's what, that's why words matter so much. And I kind of share with dentists, a lot of times dentists, dramatic words, we say things like fail and virgin, odd things to say about teeth, by the way. So I say the same things with our, fire is dramatic, right? The office is closed for this period of time.
Right.
We want to reopen the office in like a beach bar, like a favorite beach bar or a ski resort. We are closed due to this outside force. We're going to reopen. I'm just encouraging dental practice. I've been talking to people privately, trying to help them word some of this. And it's just to dial down the drama and just share the reality. We're closed, applying for unemployment. And then when we come back, we're going to have you back. And this is unfolding daily.
Yes, and we are monitoring state by state unemployment law. It's unique to every state. And so we don't have a one size fits all answer for practices, nor can we enforce any type of mandate. We're a professional association. The most we can do is make recommendations.
And I think, and that's what I want to ask you guys about, because this has been, so I've been watching so much news with Mrs. Nacho till all hours of the night. And what people thought about this 5 days ago is totally different than today. And I think is going to be different 5 days from now. What transpired for the ADA to come out with this strong recommendation? Because people were saying, we need to hear from the ADA. The ADA is our leaders. I was encouraging people to eat. I was very worked up about this safety issue. And are people going to go to work tomorrow and be unsafe? From whether behind the scenes or who you guys talked to, what transpired from sort of no specific recommendation to this strong recommendation on Monday night?
Well, remember, we are a member-run, member-organized association. I work for my members in the Board of Trustees. There was no consensus among different states about how to deal with this. We have states that wanted to move very quickly, like California, to restricting practice 2 weeks ago. We still have states now, we have 11 states now who have still not come out with a policy from their state association. So it's all over the map, to be honest with you. We have to have a consensus before the ADA goes anywhere with any messaging. And it just took us that long to look at the evidence, have serious discussions with our leadership about what the evidence was saying, what transmission rates were like, what CDC was telling us, what bioaerosol experts were telling us. Finally, the board said we need to take this step and put this out.
And
It is
that's what I want to share with
absolutely,
it. What you shared there was you guys talk to experts, you have these discussions. So when people say this is, they're just recommending, they can't shut me down. I want to use a line from my favorite movie, Zoolander, when Will Ferrell says, I feel like I'm taking crazy pills because, when dentists are saying they're waiting for a mandate, what I'm sharing and you're sharing is that's not what we want to wait for, to be ripped from our dental offices. And I am glad the ADA, I saw this on the news, they're sharing, news organizations are sharing this. So now patients are seeing, and my hope is patients are going to think it's weird if their dentist is open for cleanings because they're putting their team and their patients in jeopardy. An older patient walking in for a cleaning who's most susceptible to this disease and having this in the air and catching this is a very, very serious health problem. And we don't
right.
want to overwhelm our hospitals. I mean, we have to keep up with this. In New York, they're looking to make they're looking to make temporary hospitals because they know, like you shared in the beginning, they're going to be overrun with cases. So the more we can
Right.
keep this down, the better.
Well, I want to make sure we pay attention to the dentist needing help because somebody in the chat room just said, well, as a business owner, we don't get unemployment insurance. Exactly. So what we're trying to lobby for is a relief package for the dental practicing community, the practice owners, just like the finance relief packages came out in 09, 010 when the financial crisis hit. The federal government bailed out the banks. Well, we think to preserve the integrity of one of the most efficient and effective dental delivery systems in the world, we will need some kind of relief. So we're lobbying Congress to go beyond this bill, H201, which is really to protect employees, and to start looking at the whole dental supply industry. We are working with our vendor partners. We are having conversations with our sponsored banks. Dentists are going to need bridge loans. They're going to need lines of credit. They're going to need debt relief. If you owe student debt, let's postpone those payments for 6 months. They're going to need relief on their supply bills.
Right.
I mean, dentists are going to need help with their insurance policies, and that's an individual state-by-state insurance commissioner act. ADA does not have the ability to influence how insurance is done in each state. Can we encourage state insurance commissioners to let the policies around being closed be relaxed so that coronavirus as a government mandate is covered? So these are really important things we're discussing right now and putting teams on and moving as fast as we can with very incomplete information.
Tell me a little more about that, relief for the dental practice and the dental practice owner in the terms of bridge loans and trying to lobby for us to get this relief. What does that look like in general? Is that banks being very easy with lines of credit? Is that actual payments? I mean, tell me a little bit more about that.
All of the above. I think we need to pursue every strategy we can brainstorm about giving some economic support to these dental practices that are not like the Wells Fargo. They don't have
Right.
billions of dollars in reserves. They can operate for, 2-3 weeks at the outset, and then they get into real financial trouble.
And I think
So
what we have to be really aware of, so I'm in the big of, make the first right decision. Don't make a wrong decision to make the next decision right. But if we look at this on a bit of a timeline, we're in a unique scenario with our safety issues, OSHA, PPE. So when other businesses might be able to be open again, that may be different than our dental practice. So I really am glad to hear that you guys are lobbying for some relief for us. What I think would be best now, Kathy, is we'll take Ariel, if you're still there, she's been getting we'll just go through some questions. Maybe
sure.
they'll be repeated. We'll talk for about another 10 minutes and I'll be glad to have you on like another update here. But before we go to just some Q&A from Ariel out there, is there anything else you wanted to share at this time with the safety, PPE, how we pay our team, the ADA lobbying, anything message you want to get out to the Dental Nachos community?
Nothing that, just check our website, ada.org/virus. It's got everything that's up to date. We're updating it daily, multiple times a day. Also, we're going to push out some guidelines on what constitutes an emergency, urgent care, and then we're going to provide some help with the CDC guidelines that should come out by Friday on how do you treat a symptomatic patient under emergency circumstances, and what do you need to do to protect yourself and your staff and your
One of
people?
my ideas, I'm glad you mentioned about the emergency, because what right now do we have a working definition of what constitutes an emergency?
I can tell you what we're about to push out. Are potentially life-threatening and require immediate treatment to stop ongoing tissue bleeding, alleviate severe pain or infection, and it includes uncontrolled bleeding, cellulitis, soft tissue bacterial infection, and trauma. Urgent care is severe but less life-threatening. Things like pericarditis, postoperative osteitis, abscesses, tooth fracture, dental trauma, severe pain from pulp inflammation, that's urgent. Included in that would be any dental treatment required to get a patient ready for a transplant or other medical conditions that require dental clearance. We'd put that in the urgent care bucket. Other urgent care could be simple things like a denture adjustment if the patient's soft tissue is being torn, replacing a temporary filling. Those are all in the urgent care bucket.
So right
And
now
then
we're talking emergency. There was good definition. So emergency was the life-threatening things like that. Now
life-threatening,
you're talking more
urgent
about urgent. Gotcha.
is important stuff. You would squeeze that patient in during your really busy workday. And then what's routine: initial periodic oral examinations, routine prophylactic visits, uh, extractions that are elective, orthodontic extractions, and any restorative dentistry that's been treatment planned where the patient would not suffer harm by having it delayed for a few weeks. And then anything aesthetic, of course,
Yeah. So I
is,
like that.
is
And
elective.
I want to ask you a question as a leader, because I'm trying to be a good leader myself. One thing that's really been bothering me is I'm getting many messages from associate young dentists working from, right now, I'm just going to call this large group style practices, So I do not create a lot of emotion with a different name for this, large group style practices, saying that my large group style practice is open for business as usual. And I've sent them the ADA recommendations, and they said, don't believe the hype, don't believe the hysteria.
Yeah,
When I
I'm
talk to them,
curious about that. We've been in touch with all of them. We are in touch with ADZO, the Association for Dental Support Organizations. We're very well connected to all of those large multi-state group practices. None of them have reported to us that they are not abiding by the ADA
well, I can
recommendation.
share with you offline a number of messages and groups that could use a message from the ADA. I've sent them messages because they have scared young associates saying,
Sure.
I don't know what to do. And they've had their jobs threatened. And they've said that the whole office is going to shut down. And they've called this hysteria and hype. And it's really not right for our youngest dentists out there, or newest dentists who are scared. And they're going to their owners and saying, what about the ADA recommendation? What about our PPE? And one of the things Linda Harvey and I spoke about is they don't have the correct PPE, even if we went to the level 3 mask, right? So,
Right.
so even if we say, which I'm not comfortable with, but even if we say level 3 mask, they have level 1 mask, they don't have enough masks,
Yeah.
they don't have hand sanitizer. So I think we have to be very, very, one of my things is be
We'd be
kindly.
very happy to discuss this issue with the organizations if we know who is. We've been told they're abiding.
So
But if in
that's
fact they are
inaccurate.
not, then that's helpful
I'll be happy
information.
to
We'd
share
love
with
to
you
hear
so
it.
you can embrace what I do and kindly annoy these groups into making good decisions. My wife says just regular annoy, but it's kindly annoy. So I'm glad we got that in as well. Let's take a few questions from you, Ariel, for the last 10 minutes here. And then, like I said before, you can still send questions to paul@dentalnachos.com, Dr. Nacho at dentalnachos.com, and we'll definitely have another update with Kathy. But Ariel, share with us some questions for Kathy to answer. I got to unmute you. Hold on one sec here. Ariel. Good. You're good.
Perfect. Great. So the main question that everyone was asking was how to go about telling their employees to apply for unemployment. Do they need to use their PTO time before applying for the unemployment? And then how do they handle if they give benefits to their employees? And do they have to stop paying the benefits, and do the employees stop, and how does that work?
Some states are very state specific. So I suggest to each dentist owner who's trying to figure this out is go onto your state unemployment website and see what that particular state statute says. It's a business decision to allow your employees to use up their paid time off or their family medical leave payment or whatever benefits each practice owner provides for them. I think that's an individual practice owner decision. We understand from the feds that there'd be no penalty if dental staff went on unemployment now before the bill is passed, that whatever relief might be coming would be retroactive.
That's
to
important. I
whatever.
want you to just say that because I mean, so basically there's no penalty now. The relief would be retroactive. So you can't make an error by telling them to do unemployment too soon.
Not to what we know at this moment in time, Paul, but it's changing hourly.
Yes.
But
And
right
someone
now,
jumped
that's our
in.
understanding.
I know. They ask us, Kathy, people ask me to do things outside what I'm normally good at, which is eating nachos. But they asked about independent contractors and unemployment. I don't know if you have any knowledge or comment.
Well, if an independent contractor works in a dental practice and they're getting a 1099, they have to really be an independent contractor. A 4-day-a-week associate dentist is not an independent contractor. So that's a tax IRS issue. I know it's not an uncommon practice to avoid paying taxes, but be very careful. The IRS has a very specific definition of what a 1099 worker can and can't do.
I mean,
so check the IRS website.
Yeah, there's been a lot of comments on this, Kathy, but you just got it right on from Dental Amigo, Dental Focus attorney Rob Montgomery out there. So that is a good. He said you're dead on with that, and he's a dental focus attorney. I also want to share for clarity, because I'm an equal opportunity kind annoyer. There are many large group practices doing the right thing right now and shutting down for everything but emergencies. And I'm not talking about those ones. And I'm glad private practice, large group are shutting down. What I was sharing with you was that we are getting some non-compliance and some scared young associates. Ariel, do a few more questions here.
Yeah, another big one is if dental offices are open for emergencies and they don't have access to the N95 masks, what should they do?
That is the question we are asking CDC right now, and we expect to have some guidance by Friday. I think some oral surgeons have used their hospitals to carry out treatment in the kind of conditions that are recommended for COVID positive patients: negative air pressure rooms, N95 masks, paper coverage of all clothing, and face shields, along with gloves, which are the normal PPE. So if you may want to chat with your local oral surgeon, see how they're doing and what arrangements they're making with their hospitals in case you have an emergency that your practice is not comfortable treating. It's almost impossible to get N95 masks right now because they're all being diverted to hospitals.
And that's a good point. Someone asked that. For us to use N95 masks right now presents a host of ethical and moral issues. But I did have an idea, and I don't know how we get this, of oral surgeons and endodontists and communities banding together, because right now dentists are saying, I want to stay open because I don't want to overrun the emergency rooms with problems. But if you think about it, how often does a true I worked at Albert Einstein, multi-year general practice residency, problems breathing, problems swallowing, facial swelling. No, you're urgent, not emergent. And a general dentist, if someone has a huge facial swelling, you're not set up to handle that anyway. So maybe our oral surgeons and endodontists can work with you guys and set up centers in their town and really help. Because what I would say is, if I send my team home, Kathy, and then I say, hey, everybody come back, we have another patient, they act like they don't even know my name or number. So if everybody's home and you try to bring people in, it's going to create a problem. So I believe that that's a great point, that we have to bond with our oral surgeons.
I would encourage local efforts like that around community hospitals to have a sit down with the hospital and tell them emergencies from dental can be just as life-threatening as any other type of infection. And you need to understand what our needs are too. So I think that's an important idea and an important conversation. We are having conversations this week with the American Hospital Association, see if we can start that conversation. And this is the problem when you separate two delivery systems, right? They don't talk to each other. And right now I would say dental is kind of being pushed to the back burner by our medical colleagues. And we need to help them understand that occasionally we are facing life-threatening situations, and we need help and guidance on how to take care of these people.
It's a very important point, and that's why, I got used to that at Albert Einstein Level 1 Trauma Center with that. Also, there's just a lot of questions now about the 1099. Rob Montgomery and his team are outstanding. My Dental Amigo, yourdentallawyer.com. They can help with some of that, as can other employment-focused attorneys, because we're getting tons of messages about the 1099 W-2. All right, let's do two more questions, and then Kathy will plan another update you get your own nachos next time. We could eat them together. So, let's do.
Well, my gym is closed, so I can't eat any more junk food.
I can't start a diet. I can't start a diet at a time like this. So it's my diet's starting after all this. So, all right, 2 more questions, Ariel.
Yes, some are from, we got a couple from dental students asking if we've heard anything about what they're going to do about their student loans, as well as if their boards were canceled and what's going to happen with that.
You know, we're having active conversations on a daily basis with the dental school deans, the Commission on Dental Accreditation, and the Joint Commission that oversees dental testing is working internally to push out good communications to students to reassure them. Some of the points we've made with the deans are they can determine when somebody is competent enough to graduate. The dental school clinics are under the same constraints all dental practices are. And until the aerosol question is answered definitively, they will probably not reopen. So a lot of this is unknown. I think our goal here is to help people stay calm, take a deep breath, keep their mental health in the positive mode. It's an enormously stressful time, especially for dental students. We think we'll get traction on deferring of student loans, but again, that the first thing this federal government's dealing with is the employee bill. But we have that on our radar screen along with debt relief and bridge loans and capital adequate to keep a dental practice going. So yes, we're very worried about our dental students, and they're really busy on our chat line, by the way, for dental students.
I will do one last question. I'll do a few wrap-ups, and then we'll definitely plan Kathy to do something.
Perfect.
And the next one is let's go with one more question here from you, Ariel. And I'll
yes, I am looking. There is a good question. It had to do with what is the, I can't find it now.
Todd said you're doing a great job out there, and Carl asked if Bourbon would help. So,
thanks, Todd.
So yeah, well, you're doing a great job
appreciate
managing it. A lot of the questions are in the same things. We're still getting this PTO.
Oh, it's the ADA. What is the ADA office doing for overhead insurance? A lot of people are saying they're getting no to claims.
Yeah, I think we can lobby. NCOIL is the national, I forget what the C stands for, of insurance legislators. I think we can put some lobbying pressure on the insurance commissioners to make adaptations in every state to allow dentists not to be denied claims if they have reasonable standing with their insurance carriers. Unfortunately, we have reviewed several business continuity policies, and many of them have exclusions on pandemics, if you can believe that. So we're trying to get our arms around what the insurance industry can do. We have great relationships, of course, with Protective Life and with EDEC and several other dentist kind of involved insurance companies. So stay tuned. But my worry is that when dentists start submitting claims, they're going to be shocked that they didn't buy the coverage.
Yeah, they're saying about, can you apply for being out? I think only if a dentist is sick outside of the exclusionary period will they get paid. I think this has been awesome. I want to wrap up with a few points. My good friend and best friend from dental school, Joe Latinelli, sent me a good link this morning where in these crazy times, just bring it down to one moment. Are you safe right now? Is your family safe right now? Do you need money in this instant? The answer, my family's safe. I can get through this moment. This is a day-to-day thing. I know the human brain just projects, and we have a statement in Nacho, projection of negativity. We project what's going to happen in 4 weeks. And what I've had situations in my life where my life changed instantly in very, very tragic ways. And you have a new normal, and you got to deal with that new normal day by day. And I think that I'm thankful we have these opportunities to still connect through the virtual world, Zoom face-to-face. My team is going to share with you a really cool COVID marathon that another group is putting together with amazing speakers. I'm going to be one of them this afternoon, and they're going to talk about leadership, practice management, things in dentistry. So my team shared that in there. It's Dental Intelligence, one of our sponsors, and I think ACT, the group with Kirk Bernhardt. They put together things. I think my idol, John Coyce, is going to be in there, and a lot of great speakers. So use this time to just remember that you're safe now, act responsibly. I want to thank you, Kathy, for doing this. Can we do another one of these in a day?
I'd love to, Paul, because it's moving fast. I want to thank you too for helping get the message out. This has been a tough one.
Yeah, I don't think, read a book. If you're if you have downtime, one book, Never Eat Alone, is very good. And a big part about Paul Revere in that time. And that's my aim too. And how do you get messages out in times of crisis? And it's hard. I lived through 9/11. We think that's like ages ago. How did we get that information? We were all glued just to our TV, texting people. But now we have these channels to talk about this and communicate. And I just think that makes people feel, I know it's a very challenging time, but it makes people feel calmer when they can stay connected. So
I
that's what I want
agree.
us to do with that. So thanks, Ariel, for helping us moderate.
Yeah.
Everybody, we're going to do this again. As I said before, drop it in the chat, Dr. Nacho at dentalnachos.com, Paul at dentalnachos.com. For those of you who are used to me responding to you in 2 seconds, I'm still here with one of my best friends. He's right here, my phone. I like him. I'm getting so many great messages, but my response time might be a little slower. So you also can reach out to Ariel at dentalnachos.com. Thanks so much, Kathy. I appreciate you bringing some clarity here. And we'll talk after this, and we'll schedule another one of these.
All right. Thanks, Paul.
Thanks, guys. Have a good afternoon.